Music blares all around you. Sweat drips from everybody surrounding the dance floor. Dancing to the music and living the high life is just a good time. Nothing could be better, but then you decide that you wonder what it is like to fly. Nothing can take you down. You are unstoppable. So you climb up the tree and let it rip. Then a gut-wrenching crash fills the dark air. This sounds unreal, I know, but you just experienced a mania episode in a bipolar patient's life. They have such euphoric highs that nothing seems real or could even stop them. Working in the healthcare field, I understand what runs through their minds. I also have friends with this disorder, so I know what they go through in their daily lives. Bipolar disorder, if not controlled, not only harms the mind, but can damage the body and every person around them too. We need to understand that bipolar disorder is a serious illness that can be treated by certain medications and therapies. Let's begin by learning what bipolar disorder really is. Bipolar disorder is a serious mental illness that is also known as manic depression, and this came from wmv.com. They live on a roller coaster. They go from two main poles called severe mania and severe depression. In severe mania, they go from craziness, and they can spend all your money and have sex all the time, do drugs, drink lots of alcohol, and then they go to severe depression, where they don't want to get out of bed. They can go to suicidal tendencies and just not eat anything or eat everything and just be like a rock. It's like talking to a rock wall. And they just go up and down, up and down. And most psychiatrists want you to be on the normality wall, and this is where most people are in the normal moods. And they go from mild or moderate mania, which is called hypomania, and then to severe mania, where often they don't know what they're doing. They just are in such a crazy mood that they act on a whim. They do things like drive to Canada and back. They will jump off a cliff and they don't know why. And then they go down and they go back into mild or moderate hypomania. And then they go into mild and moderate depression. And then they just kind of don't want to do anything anymore. Like, oh, do you want to go out tonight? No, I think I'll stay in. And then they get into severe depression. And this is when you start to worry. Like, oh, I haven't seen Candace lately. What's she doing? Oh, she's at home again. Oh, well, let's go check on her. And then they go back up, and it's just the same roller coaster over and over again. And I got this information from Mayo Clinic and also WebMD. Patients live on this roller coaster of highs and lows, but often think they are fine. Let's look deeper into more of the actual symptoms of this disorder. Bipolar disorder has many symptoms to identify. Some of the symptoms of the mania are euphoria, living in this perfect world where you don't think anything is wrong. Rapid speech, poor judgment, or you make some stupid decisions. Agitation, risky behavior, increased sex drive, and probably one of the worst ones is drug abuse. And I got all of these symptoms from mayoclinic.com. Some of the depression symptoms are sadness, hopelessness, fatigue, changes in the sleep problems and appetite, loss of interest in daily activities. I'm sure you've heard a lot of these from the Cymbalta and Prestige commercials. Irritability, chronic pains, and they don't have any findings. There's no known cause for it. And the worst one by far, suicidal thoughts or behaviors. These symptoms can be hard to see, but are critical for the safety of the person. Now I must look closer to see what scientists think cause bipolar disorder. Scientists do not have a main cause for bipolar disorder, but they are in agreement that it stems from a combination of things. And the doctors at Mayo Clinic have come up with three main things. Biochemical imbalances in the brain play a major role in bipolar disorder. The serotonin levels are very high in the mania episodes, and they are very low in the depressive episodes. Family genes also show that this disorder can be inherited. If someone in your family has it, then you have a greater chance of getting it. This does not necessarily mean that you can get it, but there is that chance. The environment also cause some triggers for bipolar disorder, such as high stress or effects on your self-esteem. And this came from Mr. Keith's psychology book. Now, everybody has this disorder, therefore let's look at the statistics as to how many really do. Nearly 1% of the current population has bipolar disorder, but that is only of the ones that seek treatment. Some researchers believe that more people have the disorder and that around 6% actually do have it. Bipolar really begins to affect people during ages 15 and 30. Women are more generally affected, and Dr. Mark Goodman out of Hutchinson says he sees up to 6 or so bipolar patients every week, and that it is a very common illness. And he is a clinical psychologist and also a clinical psychological pharmacologist. And if anybody wants to make an appointment, just come see me. He is a great guy. Since we now know what bipolar disorder is and what causes it, let's see how to treat it. Bipolar disorder is best treated with the help of a skilled psychiatrist and other mental health workers trained in the field. And this is coming also from the doctors at the Mayo Clinic. Medication is widely recommended to help treat and control bipolar disorder. Mood stabilizers and anti-seizure medications are often used to help treat bipolar disorder to calm the mood swings. And this comes from the Lexicon Drug Reference Handbook. Antidepressants can be used only with mood stabilizers. They should not be used alone. They often increase the mood swings and develop even more problems for the patient. Some antipsychotic medications may help if the other meds did not help any of the bipolar symptoms. Medication is often used to treat and control this disorder for a lifetime. Psychotherapy is another major part of the healing process, and this comes from the doctors at WebMD. Cognitive behavior therapy includes one-on-one sessions with a skilled professional to help identify problems in their lives. Family and group therapy also helps reduce stress to learn how to make life easier and healthier all around. Now that we know that bipolar disorder is a major illness, we need to know how to help your loved ones in danger. If you know anyone suffering from these signs or symptoms, please seek medical help immediately. Contact a close family member or even your minister. You can call the local medical center, the clinic, the emergency room, or the crisis hotline. It's an easy number, 1-800-SUICIDE. That's easy. I mean, look up the number. 1-800-784-2433. It's not funny. They're suicidal thoughts. You can't mess around with those. Please get help. We live in a very complex world filled with stress and anxiety. No one chooses to live with bipolar disorder. I never thought that I would one day be diagnosed as a crazy lady. I'm not crazy. I made some bad choices in my mania episodes, and I still have no idea why. I try to remember or realize, what were you thinking? Bipolar disorder has not only affected me, but my whole family. So now that you know what bipolar disorder is and can see the signs more clearly, will you help someone you love and get them help?